Welcome to this presentation on cardiac rhythm monitoring, telemetry referrals, and accountabilities. CRM is essential in caring for patients with cardiac concerns, enabling our team to detect and respond rapidly to potentially life-threatening arrhythmias and other critical cardiac events. With CRM, we gain real-time insights into patients' heart rhythms, allowing for timely interventions that can significantly improve patient outcomes. This presentation aims to ensure a thorough understanding of the telemetry referral process, clarify each team member's responsibilities, and outline the best practices for effective patient management. By the end of the session, you'll have a detailed view of the procedures and accountabilities involved in cardiac rhythm monitoring. Telemetry monitoring is invaluable in healthcare as it provides continuous, real-time cardiac monitoring for patients who require close observation. This technology allows clinicians to quickly respond to changes in patients' cardiac status, facilitating early intervention and better clinical outcomes. We will examine the telemetry referral process and review the specific steps for initiating a referral, outline the accountabilities for each team member, and discuss patient management protocols. This includes guidelines for safely discontinuing monitoring when it's no longer required. Let's begin by taking a closer look at the referral process. The telemetry referral process begins with the patient assessment by a consultant or a registrar. If a patient is identified as needing CRM based on our inclusion criteria, the referral is then initiated in the clinical portal under Internal Referrals and Cardiology Procedures. Once the referral is submitted, the telemetry nurse receives and triages the referral, checking for completeness and confirming that all eligibility criteria are met. If additional clarification is required, the telemetry RN consults with the referring clinician to confirm the indication for monitoring. A referral may be declined if it doesn't meet the criteria, and this decision is documented in the referral form. This process ensures that only patients who meet the CRM criteria receive telemetry monitoring, optimizing our resources and focusing care where it is needed most. Certain criteria guide the decision to initiate a telemetry referral, and understanding these is key to providing effective care. First, patients must meet specific clinical indications such as arrhythmias, acute coronary syndrome, or other high-risk cardiac conditions. Each criterion ensures telemetry is only applied when there is a justifiable need for continuous cardiac monitoring. Patients who are confused or agitated may require further evaluation, as telemetry monitoring depends on the patient's cooperation. Consent and an understanding of the process by the patient are critical for monitoring to be effective. By adhering to these criteria, we ensure that telemetry is used appropriately, promoting both safety and resource efficiency. The telemetry nurse has a central role in managing CRM referrals and ensuring patient safety. Key responsibilities include triaging referrals based on inclusion criteria, documenting the referral decision, and monitoring patients' cardiac rhythms. Consistent documentation of rhythm trends and any significant changes is essential. The telemetry nurse must also immediately notify the primary nurse of any significant rhythm events and, in cases of life-threatening arrhythmias, place an emergency call without delay. The telemetry nurse is also responsible for implementing escalation plans when telemetry resources are low. These responsibilities ensure that all team members are informed and that patient monitoring remains uninterrupted and effective. Referring and overseeing clinicians play a critical role in CRM by ensuring that telemetry is used appropriately and by maintaining accountability for patient outcomes. They must initiate referrals based on a thorough patient evaluation and document the need for CRM in the patient's clinical notes. Clinicians are also responsible for daily reviews of patients on telemetry to assess ongoing need, taking into account total monitoring time, including any monitoring done in ED or ADU. At the end of each shift, the responsible registrar must hand over the care of CRM patients to the on-call team to maintain continuity. These actions ensure that monitoring is clinically justified and that patients are continuously reviewed. Cardiologists have specialized responsibilities in CRM, particularly for reviewing and interpreting telemetry data. They conduct referral reviews at least twice daily, considering any changes in heart rhythm that could impact the treatment plan. In addition, cardiologists make critical decisions on extending or discontinuing telemetry and may adjust patient management based on CRM findings. They also play a role in implementing escalation protocols in the event of telemetry shortages or outage. Effective patient management on CRM involves several essential steps. First, the telemetry nurse confirms patients' details, monitors rhythm changes, and checks blood tests relevant to cardiac monitoring, such as troponin and electrolyte levels. If any significant changes occur, the telemetry nurse immediately informs the primary care team. In cases of abnormal rhythms, specific escalation pathways are followed to ensure quick intervention, including emergency response if necessary. Accurate and timely documentation of each event and intervention is crucial for maintaining continuity of care and helping the clinical team make informed decisions. The ward nurse, or the patient's primary nurse, has specific responsibilities when setting up telemetry for a patient. They begin by obtaining the patient's verbal consent and providing the patient with a patient guide to telemetry pamphlet. They then prepare the patient's skin for ECG lead placement, verify patient and telemetry details with the telemetry nurse, and ensure that the electrodes are placed correctly. Daily reviews in clinical e-notes are also necessary, as is notifying the telemetry nurse if the patient's condition changes. These steps are essential for starting CRM smoothly and ensuring reliable telemetry readings throughout the monitoring period. Ward nurses are responsible for ongoing monitoring of patients on cardiac rhythm monitoring. They replace ECG electrodes daily to maintain accurate readings and remind patient to report any symptoms such as chest pain or palpitations and report these to the telemetry nurse. The ward nurse must also document any patient movements, transfers, or non-compliance issues and keep the telemetry nurse informed of changes in patient status. In cases where telemetry nurse requests follow-up, the ward nurse may need to perform additional assessments or notify the medical team of significant findings. Consistent follow-up and communication are key to effective cardiac rhythm monitoring. Transporting patients on CRM requires careful planning to ensure patient safety. All patients must be transported with a transit care nurse skilled in rhythm interpretation. For high-risk patients, such as those in the coronary care unit, an AED must be readily available. Cardiology patients are assessed by their responsible clinicians and primary nurse to determine if AED support is needed during transport. The ward nurse or transit nurse must notify the telemetry RN when the patient leaves and when they return to maintain accurate monitoring records and patient's update. This process helps ensure continuous patient monitoring and minimizes risks during transport. Please refer to the CRM policy for specific advice in the use of AED for transport of patient on CRM. When cardiac rhythm monitoring is no longer required, or when the monitoring period or completion criteria have been met, the telemetry referral process must be completed. The telemetry nurse is responsible for notifying the primary nurse of the discontinuation and documenting the patient's final cardiac rhythm and the reason for discontinuation in the clinical e-notes. Additionally, the telemetry e-referral must be completed. Once this is done, the ward nurse will disconnect the telemetry equipment from the patient, clean the monitor following infection control protocols, and return it to the telemetry station to ensure it is ready for the next patient in need. Accurate documentation and proper handling of the telemetry equipment are essential for maintaining hygiene standards and ensuring the device is in optimal condition. Cardiac rhythm monitoring requires a collaborative effort among all clinical team members, from referrals and accountabilities to patient management and transport protocols. Each step is designed to prioritize patient safety and effective monitoring. We've covered the roles and responsibilities of the telemetry nurse, the referring and overseeing clinicians, cardiologists, and ward nurses. Adhering to these guidelines is essential for optimizing telemetry use and providing the highest standard of care.